Okay, it's 1 o'clock, so I know everyone's time is really precious right now, so we're going to go ahead and get started if that's okay. And again, it's really super important that everyone stay on mute as much as possible so we don't have a lot of the background noises and things going on. And also just want to make the announcement that if you have questions and as they come to you, or if you have them ready for chat, we will take them via the chat box on the side of your screen, and you can open that up and move it to the side if you'd like, and then we'll address them either through the presentation or at the very end we'll have a Q&A portion. So encourage you to stay interactive with us and ask any questions you might have related to business recovery or reopening. So we're going to go ahead and get started. And first, I just want to take a quick second to thank everyone who has helped to put this available or helped to put this together. I know it's taken a lot of work, and we've been meeting regularly with a group which originally started with the Emergency Operations Center support function, and it has now turned into a recovery support function. So that group has been very active in helping to put these things together. So I just want to take a second to thank them. And also to our county staff and city staff who's helped along the way also to put these presentations together. So with that, I'll quickly run down through the partners in the organization that have been meeting on a daily basis on behalf of the business community. And that's the Department of Business Development from Washington County and myself, Susan Small, as director. The Director of Community and Economic Development, Jill Thompson, from the City of Hagerstown. The Executive Director of the Washington County Chamber of Commerce, Paul Fry. The Executive Director of the Convention and Visitors Bureau, Dan Spedden. The Executive Director of Greater Hagerstown Committee, Jim Kercheval. The Chief Executive Officer of Goodwill Industries on behalf of nonprofit organizations, Dave Schuster. The Director of Public Safety and Campus Police, excuse me, that would be Eric Byers. And as well as the Director of the Western Maryland Regional Economic Development for the Department of Commerce, Andrew Sargent. So just thank you to all of them. They're also on the call, and they will be partially available to answer some of the questions as we move through it. So I want to also take a second to introduce our panelists today. And Danielle, you can go ahead and move forward with the slides. We have our Chief Executive Officer of Meritus, Dr. Malak Joshi, on the line. And I believe we also have our Health Director, Earl Stoner, on the line today. So thank you so much for taking the time to join us. We really appreciate that as well. And of course, thank you to all those who are on the front lines as we move through this pandemic. Just really important to note, you can forward the slide for me, that I know we have a lot of folks on the line today. So again, just a reminder to keep yourself on mute as we go through. The webinar is being recorded, and Brittany, I see, has put the presentation is going to be available on our website there. So you can go back and visit at any time. The slide deck will be there for you. But also, just to note that the webinar today, the purpose of the webinar today is really to provide the businesses with the latest health information, and as well as just giving you the starting guidance as we move through each phase, and some resources available to help you reopen. And then obviously we're going to have a nice Q&A at the end. So, but again, if you have questions as we move through it, please don't hesitate to type those in the chat box. Next slide. So I've kind of said all of that at one, but I want to point out our washcorises.net website. that is a very important resource for you. It's sort of a one-stop shop. It'll have some toolkit example there, as well as checklists for you and some updated information and resources for funding. So just make sure you visit that at some time. And then this is a public webinar, so just note that the press may be on the call. Next slide. And lastly, just a real quick disclosure that we're here for support of your business, and we understand from the business community how difficult this has been. Many of us are feeling the pain as much as you are, but we're weathering the storm together. We're going to try and give you the best advice as we can, but we, at the end of the day, are not the professional teams that you and legal teams that you should be consulting with. So we just want to make sure you understand that while we intend this to be an accurate presentation, we feel that you should probably consult with your professional teams before making any other business decisions. Next slide. So we'll just start with a brief how we got to this point. And again, Earl Stoner is on the line today, so he can answer some of the questions you may have about where we are and how it relates to Washington County. But just as a general overview, this started March 5th when the governor declared a state of emergency. And the last several weeks, we've been following the executive orders in forcing people to stay at home, shutting down non-essential businesses, and limiting our large gatherings. And of course, with that comes the social distancing and restrictive measures so that we limited the spread of the virus and thereby preventing a surge in new infections. Next slide. We wanted to share with you some of the dashboard information from the state of Maryland, and the top 4 building blocks to recovery, which were outlined by Governor Hogan some time ago. And so that was to expand testing capacity, and then we want to ramp up our supply of PPE and look at the contact tracing operations. But it's really important to just see there's the curve at the bottom. And again, I'm going to kind of rely on Earl Stoner here a little bit. Earl, if you could unmute if you want to give a few statements about how this relates to Washington County and where we stand. I think that would be a pretty good time to do that.
And if Earl's on the phone, it's *6.
Oh, yes, you have to *6.
Yeah, can everyone hear me now?
Yes.
All right, sorry about that. So yeah, we, from the standpoint of the 4 building blocks, that's sort of our sort of critical point that we're at now. The governor has laid those out. You had actually had those on just on the previous slide, I believe. From the standpoint of testing, Meredith has done and continues to do a tremendous job with testing and expanding testing. They've carried the weight on that. We actually, if I can remember correctly, I don't have it in front of me, but our testing numbers, the number of individuals tested in the community, are pretty high in comparison to other respective counties. That's a testament to their Meredith's ability to really ramp up capacity. And they're also, now we're at the stage where we are beginning to test asymptomatic individuals. That is a critical point for us, and not just here in Washington County, but in the state and within the country, because you really want to have a good snapshot as you move forward and reopen. And, you know, like, what is the current view of the virus in our community? And you really need to include those asymptomatic individuals on that. And that expansion is occurring with Meredith and their testing. Also, having critical surge capacity if not one of the most important. You obviously want to not ever get into that, but if you really do need to get into that, you obviously want to have expanded and adequate amount of hospital capacity for a surge that may come in. That could be, you know, a tremendous surge in new cases, or it could be from a cluster, it could be from a nursing home, or it could be from some other outbreak within the community. So Meredith has also worked with the EOC, but they have done a great job at having built their capacity and having a good surge plan in place. The other two would be robust contact tracing. That is the function of the health department, and that is really self-explanatory. As soon as somebody gets tested, they get in to a contact tracing program. We follow up with them, typically within hours of the positive test result coming back, and get that individual isolated, find out who their contacts were, and what the risk level of those contacts were, and if they need to be isolated. That is a critical function, because in essence, the concept is you're breaking the chain of transmission. So the virus doesn't have a chance to infect anyone else, and it's really a containment strategy. And then lastly, adequate supply of PPE. We are at a stage now in Washington County where we are a lot better with PPE than we had been early on. A lot of the supply chains and whatnot, log jams have been broken. Still, you know, very critical, and still not something that we're totally comfortable with, but we're managing. We are continuing to get adequate supplies of PPE out there. So they're the big four. I know that Moloch's on the line, and we, along with Meredith, the EOC developed sort of a dashboard. He may be able to speak to that, but really, as we move forward, we still need to do it cautiously. You know, not saying that we can't in some regards, but we need to really keep our eye on hospital capacity and what the hospital numbers are, any outbreaks, any clusters, and really new cases, especially from a doubling perspective. So in a nutshell, public health-wise, that's where we are right now.
Thanks, Earl. Greatly appreciate that. You want to go to the next slide, Danielle? So I know that it's really taken a lot of hard work from everyone's standpoint to get us here, and I'm sure you know, the folks on the front line and Earl and Malak can confirm this as well. But it's just really important to note that there are a lot of folks working to promote a safe reopening as quickly as we possibly can. And that includes local officials as well as our state officials. You know, the delegation has been here each time supporting us as well. So just want to say thank you to everyone, and your hard work and your sacrifices, down to the businesses who have done what they could to keep the safe distance and keep that curve low. So it doesn't necessarily mean that we've beaten the virus, of course, but we still have a long road ahead, but we are moving in the right direction. Next slide. So just want to again reiterate, at this point, we are in stage 1 of the recovery plan, which allows for, you'll see on the right-hand side there of your screen, the businesses that are allowed to come back at this point and the details behind that. Just please know that this document is located on our website. So if you want to look at that a little bit closer, please feel free to visit washcorizes.net, and you can download that. But the local jurisdictions have been empowered to decide the timing of stage 1 openings. That doesn't mean that we can't jump ahead, but that means that we can have the option to be a bit more restrictive. So our local officials can either back things up and not, we can't jump ahead or implement stage 2 until the governor has approved us to do that. And based on our health data and current capacity, as Earl just spoke to, Right now we're in the position to open the county to the full extent allowed in stage 1. Next slide. Again, just another nice graphic here showing the full state of Maryland and highlighting Washington County effective May 15th to move into stage 1. Next slide. So just one important kind of the purpose of this, again, to reach out to businesses. And so you understand there's a very delicate balance here. And we completely understand, we empathize with the troubles that this has caused. And, that's why we're here to help you on the recovery and the reopening stages. But just to encourage, while we're opening our economy, we also need to protect the health of the public. So to continue your social distancing and safe practices, continue to monitor, the key health statistics from around the state and the county. We have preparations available to you and resources for you on that website. And so we encourage you to check those out. There's also financial support there. And more importantly, to build the confidence in our consumers, we need to take the right steps in moving forward. So next slide leads me to bring Dr. Malak Joshi on, and I'll have him present some facts here from Meredith.
Great, thank you, Susan. Good afternoon, everyone. Hi, this is Moloch, and thank you for the opportunity to give you a little bit of where we're at. Thank you, Susan, for all that you're doing. Thank you to Earl for his tremendous leadership at the county level. I think we're at a place that we didn't think we would, which is a good thing in terms of where we're at in terms of this pandemic. And it's thanks to Earl and the EOC's leadership. And I also just want to say again, thank you to our business community. You've really been here for us, our staff, our doctors, our nurses, our therapists, the healthcare heroes, and we want to be here for you as well whenever you need care. So just thank you to the community for your tremendous generosity to everyone. So this first slide just tells you where we were and where we are now. We thought back in April, not too long ago, that we would surge up to a very high peak in the end of May now of about another 100 plus patients, COVID-19 patients. But through all the measures, the public health measures that we have all been doing together, the social distancing, the closures, unfortunately, and other things, we've been able to continue to flatten this curve. So you can see as of May 4th prediction, we dropped this by a third. And our latest prediction flattens this curve even further. So that's great news. But the other important part of this is, as Earl said, we are ready for a surge. We can surge up to 359 beds just at Meredith Medical Center. So that's another 120 beds on top of what we have. So one is we are ready for a surge if one happens and when it happens. So that's one. On the next slide, please, you can see what Earl mentioned in terms of our COVID dashboard. And he mentioned many of these things, so I'll just run through them quickly. Testing, that's a big deal. We are offering testing with no charge to the patient. We've done over 7,000 tests, and we're now doing close to 300 to 400 a day now through our drive-through and our walk-up center, and of course in the hospital if you're an inpatient. So we have the capacity to do that. That's a good thing. PPE availability is a yellow just because this is a constant, daily, hourly, constant looking for more PPE. There's not enough, so we're at least not in the red. We've got adequate supplies, but we continue to look every day. Current bed capacity, as you can see, we're only at about 60% capacity, so we've got room. Ventilator capacity, that was a major thing that everybody was concerned about. We would know once we hit 80% of our ventilators in use that we would have to trigger it to the next level. We're below 20% right now, which is a great thing. New COVID admissions, we have been getting about 1 to 2 a day for a month and a half. So our trigger is if we have 2 or more for 6 consecutive days, that means something else. And right now we're green. As I mentioned, surge planning, we're green. Days since doubling of cases, we're actually now closer to 20 days of when it takes before the number of cases doubles. So we're in a good place. Outbreaks, Earl said this so well, we continue to watch that. 1 or 2 outbreaks can triple, quadruple these numbers. And we're watching at the nursing home level, but so far so good. Earl mentioned the capability of the Department of Health for their ability to contact trace, and deaths. One is too many, but one of our triggers is to make sure that we don't have one or more a day for 6 consecutive days. We've had 6 deaths in total at Meritus Medical Center since the start of the pandemic. So next slide, and again, as you can see, we're at green, couple of yellows, but we're doing in a really good spot. And of course, we continue to track the number of inpatients. As you can see, a small number of COVID patients, 12 a day. I wish it was even lower, but compared to some of our neighbors, it's really dramatically lower. And the next slide, again, just gives you a little bit of notion of our capacity, both for medical surgical beds, for ICU beds, and ventilators. The lines show you where we can go up to, and the dotted lines above show you how much capacity we have. We are below our capacity, so we can handle a surge. So just wanted to again say thank you for the opportunity. I hope you could see we are tracking important metrics to make sure we stay on this and be ready for any changes. We are in the green for most of this. Thank you to all, and we have to continue the bundle of interventions, the hand washing, the social isolation as appropriate, the distancing as appropriate, and we can reopen safely. Turn it back to you, Susan.
Thank you.
The last slide, just to show you again, is just the number of new hospitalizations, which again, we've been hovering at the same amount for the last month and a half.
Okay. All right, so as mentioned before, we have a really useful website here. It's our one-stop shop for reopening information. And I think it's just important to note a few little details on here. There is a preparedness list on there. If you haven't already, you should check that out, as well as the toolkit, which is available for download or print, and it's being updated daily. So, I mean, as information comes in, you know, we're checking on that and updating it for you. So please feel free to download that. There are also some business resources for funding and safety best practices by industry. So if you're in a specific industry and you want to see best practices there, we've got some resources for you. And stay tuned, because we are currently working on our plan for the Together We Rise local grant program for business stabilization. So hopefully we'll have that out very, very soon. So next slide. And this was something that the governor presented on the 15th, or well, prior to the 15th, for businesses to sign the Maryland Strong Back to Business Pledge. And it also is available on our website there. You can download it, sign it, and post it so that whether our citizens or your customers, it's just another way to encourage the consumer confidence that we need during this time. So please feel free to go on and download that and sign it and make that pledge. And next. So lastly, I see we're starting to get some questions here. So I'm going to queue up Paul if you want to try and moderate some of these questions with me. Again, please use your chat function to ask questions or leave some feedback. We're going to be answering as many as we can in the best time that we have here, and we'll do the best that we can to answer it with all the resources that we have on the call here today. But as we collect the questions, we're going to be creating a living, breathing document with a FAQ on our website. So continue to send those in to us and stay in touch. But again, from the Department of Business Development and all of our partners, just want to say thank you for being on the call today, and we are going to continue the conversation here. So,
Hey, Susan, I'll look up the first question. The first question: in the state of Maryland, if an employee says their family member that they live with tested positive for COVID-19, can we ask for proof? And what would that proof be that we ask for? So I'm going to look, unless either Dr. Joshi or Earl Stoner know that. And while they're thinking about this, next question is, Dr. Joshi or Mr. Stoner, masks are unhealthy. I'm advised not to wear one. This limits my daily routines. This person says masks are not mandatory but voluntary. Governor Hogan's words were masks are strongly recommended. So why are stores making it mandatory?
Yeah, this is Moloch. I can start and ask Earl to jump in. So a mask will not protect you from COVID-19 per se. That's correct. But many people are asymptomatic and may have the coronavirus. And so the mask can prevent the spread from one person to another. They're not ideal. It doesn't feel great, but we do see it as an important public health intervention in terms of using a mask to prevent the spread to others. Again, if you're in direct contact with a patient, it's a different story. But in terms of general business, that is an important thing. Earl, do you want to add to that?
Yeah, can you hear me?
Yep.
Okay. So what was the other part of the question? About employers?
I'm going to look that one up here, but what if you know, what they're asking is if an employee says that they have a family member that's been diagnosed with COVID, can the employer ask for proof of that employee?
I'm not. We have been in that situation, and we have sought the guidance from the state on that. I'm not 100% sure on that. I can find out exactly and get that out to the group. But I'm not 100% sure about that. Typically, it's handled.
I'm looking right now. I'm looking right now to see if I can find it. But if you want to address the other one that Dr. Joshi talked about as far as masks.
And which one was that?
Masks.
What was the question?
Person was suggesting that masks are mandatory.
Well, masks are supposed to be worn when somebody's on public transit or in a retail setting, unless they have a situation where for instance, we have individuals who have disabilities that are not able to wear those. Then in those situations, they can work with in the retailer case, work with the retailer to make reasonable accommodations for them. Some of the things that have been done have been the store allowing the individual to shop without the mask. Others have worked with the individual or individuals to basically get a list of things that they would need and do the shopping for them. So individuals who have disabilities or have other issues, someone could have COPD and have difficulty breathing. They need to bring that to the attention of management of the retailer. But masks really face coverings are mandatory to be worn in retail settings in Maryland.
There's a question about drive-through testing. Do you want me to answer that, Paul?
Yeah, please go ahead.
Yeah, so the question is about drive-through testing. Drive-through testing is open to anyone, whether you have symptoms or not. So at the Meredith Medical Plaza on Creighton Boulevard, you can go there for testing, COVID-19 testing, regardless of symptoms. Not to Meredith Medical Center, that's only for if you've been inpatient there, do you get tested.
And thank you. We got some good information for the question about if you can ask for documentation. And it's good recommendation. I did listen to a webinar with a labor law firm, and their suggestion is the Department of Labor website answers those questions. There's a FAQ that you can ask for documentation, you can't require it. It's a balancing act of safety. And so we'll put a link to the Department of Labor, and there's FAQ there as well.
And Paul, with regard to the other question, I think about a family member, we would not be able to disclose that information without the consent of the individual.
Thank you.
It would be a HIPAA violation.
Let me just see here.
Paul, another quick question says, if you work in the county but live out of state, can you get tested emeritus? And the answer is yes, you can still go through the drive-through and we will test you.
There's a question about purchasing masks for the office. It seems to be nearly impossible. Is the county planning to take consolidated orders from businesses to make it easier for us to receive appropriate protection sooner? So I don't know if there's a central place where a business can find some. Our work group is contemplating, can we do that? Can we be a resource? We don't have an answer yet, but Earl or Moloch, any direction on where folks might be able to get masks? I know you're looking for them as well, if it's depending what they are for N95 or what types they are.
Yeah, I would let Earl answer in terms of the county. If you're not in direct patient contact, we wear the cloth mask. We do not wear surgical masks. But again, I'll let Earl answer that.
No, off the top of my head, that's been something that we've talked about here at the EOC. We're not in a position right now for non-medical providers to provide that. I know that dentist offices and other healthcare providers in the community can get at least a start on with their PPEs from us until they get their supply chains moving again. But just for the general public or general employers, that we aren't in a position to do that at this point. However, we have talked about trying to develop, even if it's a link where individuals can go for getting back into purchasing a PPE. We haven't established that as of yet. We're still discussing that, and if that's even something that could be developed at this point.
Let's see here. There was another question. Are there any guidelines, and Earl, they're asking on behalf of the health department, are there any guidelines yet for youth summer camps?
No, unfortunately there aren't. This is something that we've been waiting for a number of weeks from the state, Maryland Department of Health, and unfortunately we do not have those. I don't have any guidelines.
I did just
I've been
send
told
out.
that they're being developed.
Go ahead.
Excuse me, sorry, Paul. I've been told that they're being developed, but I don't have a copy of those, and I have not seen them.
I did share with everyone in the chat room the website or the link to Department of Labor. If you have a question about questions, you can ask. So there's a good site there. Earl and Dr. Joshi, I've been referring people to CDC. There's a lot of conversation in the chat room about masks and that. Is that a good site to get information about masks and when you should wear them and the value of them?
I think the CDC is a terrific.
Yes, I would say so.
Yeah, it has the best resource, evidence-based. And I would say, again, as everybody knows, this is changing not just in our state, but around the world. And so there's a lot of evidence now talking about universal masking in countries doing that. So I'll be honest and tell you, I don't think we have the right answers on all these things, other than we're all trying to figure out what are some of the ways. And the other thing is, it's not just one thing, it's all of these things, right? So still being 6 feet away, and all those are important things to think about.
And I would echo what Dr. Joshi just said. From the public health perspective, as he mentioned, CDC and the CDC recommendations are our go-to. Now, with that said, we also, have to adhere to guidelines and orders as they come out of the state. So, but as far as general recommendations for masks and those sorts of things, CDC develops really good guidance.
I want to emphasize, and then I want to ask Jim Kirchfull his perspective. I want to emphasize what Susan mentioned earlier. Everyone on this call who's working on your behalf and trying to get you information, we all want to get businesses open. We all want people to be able to go to camps and to go to the gyms and go to restaurants. Believe me, we want to do that. We're working to do that. And as Dr. Joshi and Earl talked about, there's guidelines for the safety of the public, for our family members. And so we just want to emphasize we're working as hard as we can with our elected officials at the city, county, state level, at the federal level, to make sure we can do things as quickly as possible, as safely as possible. And we encourage you to direct your questions and concerns to us. We want to work on them for you. We all want the same outcome of safely and responsibly opening back up. Jim, I don't know if you want to add to any of that we've talked about over the last few days.
Sure, Paul. You know, we were in a conversation last night with a group of mine and talking about how a lot of times people want to put economy versus health as like two separate things that are competing with each other. And what we need to do is look at them both as intertwined and working together. The economy, you know, if the economy's bad, that's going to affect public health in other ways. That's why it's important we get the economy going again. So they're not an either or one versus the other. They need to work together. And what, you know, I think every community is trying to do is find that right balance and try to do that, you know, get the economy open, get unemployment, you know, lower. That always increases public health, improve the education system, which we know is not quite up to par when it's done virtually versus, you know, face-to-face, particularly with our younger kids. So all these things affect public health in the long run. So we're trying to find that right balance. The biggest thing I hope people take away from today is the need for our community to stay in that safe zone, to stay within the capacity of our medical providers to treat you if you do get sick. So when we're talking about the mask, you know, more from a layman's view, the way I've looked at it, I wouldn't think the mask so much as a way to protect you, to get a, you know, a piece of the virus to enter through that. We're not, you know, recommending that the general public wear those level of masks. We want to save those for the health professionals, which, you know, are the ones that really need to have them. What you do, you know, the spread of the virus has been shown, the biggest spread of the virus is from liquid droplets that people put off through talking and sneezing and coughing and those sort of things. So when you wear your mask, you help limit the amount of that a person puts off. So you're decreasing the chances that people around you get infected. And, you know, that really is our goal. I know sometimes those things are uncomfortable and you know, it's awkward to wear, particularly depending on what you're doing. But, you know, our role is, as each citizen is tried to limit and lower the risks to other people around us as much as possible, so that as people do get infected with COVID, which is what we expect, I mean, that's going to happen until we have vaccines. But as people get infected, we stay within our limits as a community to treat them and treat them properly. So, you know, out of respect for the workers you come in contact with, out of respect for the customers around you, anything that you could do yourself to help limit the chances that you have the virus and not know it and are spreading it by accident, you know, masks help with that to some degree. They don't help 100%, but they certainly decrease the amount of liquid that you're putting out. So, you know, whatever you decide as you make those choices, try to think about the overall good. For the economy, if we go back to where we reach those limits and all of a sudden have to go backwards and start closing things down and sheltering in place more often, you know, most economists from the articles we're reading say that's going to be worse for the economy than a staggered opening. So, you know, we want to try to open as quickly as possible to get the economy going, but we also need to stay below that threshold so we don't go backwards and actually do more damage to our economy long term than a staggered opening.
Thank you, Jim. We have another question. I'm not sure anyone has the answer, but one of our panelists maybe can address her, someone who's been working on this. Do we know a projected timeline to getting into phase 2 if numbers keep on the current trend? I don't know if that's Dr. Joshi, it might be more of an Earl question.
I think it's an Earl question.
This is, I don't have any. I mean, unfortunately, it's all predicated by the governor's schedule. I've been told that there's the potential for a press conference next week, but I don't. Yeah, we're unfortunately not privy to any state level plans as far as reopening or phases or anything like that.
And obviously, you know, I know the governor and all the other counties in Maryland and frankly around the country are looking at, once they start to reopen, what's the impact on the health of the community and on our health resources. So I'm sure the governor, I'm imagining he's looking at, you know, we opened up partially last Friday. He's going to look at the data, see what's happening, and see what makes sense to open up. And then again, we'll follow the guidelines and work closely with those guidelines. Just responding back to finding proper masks and cleaning supplies. A couple people have posted on the chat room some resources. I know Andrew Sargent from Maryland Commerce posted a source. Again, we're looking here locally to provide you some direction to some supply houses that might have what you're looking for. So stay tuned. Again, keep asking us and we'll share the information when we get it. I think that addresses at least the questions that have come into the chat room so far. If there's other questions, we certainly can entertain them. And I don't know if Jill is on the call with us, I couldn't see yet. Jill Thompson with the city, if there's been other questions that your department has been asked. And Jill may not be with us on the call. I did see Dr. Boyd Michael. Hi, Dr. Michael. I don't know if, from your perspective, Superintendent of Schools, if you have any feedback or comments. I know school has been mentioned. Good afternoon.
Good afternoon. Sorry, I was in another meeting here for a while. Yeah, I mean, a great deal of confusion. We're still 90 days away from the start of the new school year. We're obviously, trying to wrap up this school year. Graduation is still a big question mark. We're all working on trying to have some level of an in-person graduation. The health department's been working with us. We appreciate your staff are working with us. We're trying to have summer school, but it may end up being virtual. And then there's a whole lot of confusion about what's going to happen in the fall. CDC's put out some things. Maryland's kind of done a preliminary plan of what it might look like if we have to maintain social distancing and mask and all those types of things. I mean, you can read the words, but it doesn't come out very practical from what we're looking at so far. I mean, we will always come up with a way to make it work and do the very best we can. But, 6-8 kids in a classroom, 4-year-old wearing a mask all day long, or changing a mask multiple times and having those resources, 8-10 kids on a bus. We have bus stops that pick up. We have bus stops that we have 3 buses go and pick up at the same bus stop, all coming out of an apartment complex or something like that. I mean, we're gonna go and pick up 8 kids, and somehow I'm gonna have 3 more buses come right behind those. I mean, from a practical standpoint, we're challenged by that, but we're working on all of it. We're preparing if we have to be virtual again the first day of school. We're preparing if we're a combination of virtual and in school, and my hope would be we're back, but I don't know. We'll just have to see. I'd be glad to answer any questions I can if anybody has one for the school system.
Thank you, Dr. Michael. I just posted for everyone to see guidelines for various business practices, best practices for the different industries at the maryland.gov website. That is a good website. Again, U.S. Chamber has some good guidance for certain industries, and if you have questions about best practices, they're there.
Paul, I see there's a question about notice for restaurants and things like that, and what to expect on notice. What I would tell you, the advice I tell you is we're probably not going to get a whole lot of notice, and that's kind of the nature of the way things have been going all along, and that's not necessarily a bad thing. I think the governor monitors his situations and the stats, and when he makes a decision, he's going to announce it. Usually it's only a day or two, as he did last week. He kind of made an announcement Wednesday, and then Friday, stage 1 began. So what we're encouraging businesses is to make sure you start preparing things now for what you can do ahead of time. So go ahead and start thinking about, your eating facilities, and if you do get dining in, how can you do social distancing with your tables? You're probably going to have some sort of restriction with occupancy rate, the percent of occupancy. We just don't know exactly what that'll end up, but you're not going to want to have tables back to back. So start laying out your restaurants. There's a lot you could do with plexiglass. If you've been to the places that have already opened, you'll see some of the plexiglass that they're putting in different places to protect their workers, as well as anybody that's in, direct front contact with customers coming in. There is a document on the website about the 10 things businesses could do to prepare to reopen. I'd encourage you to go to that and look at that document and just do as much as you can ahead of time. Part of that document talks about conversation with your employees. So we know you want to have conversation with your employees that see where they are. So when you do make the call to come back to work, that they're prepared and ready. So I wouldn't wait to do that until you're told phase 2 is opening. I'd keep constant conversation all along the way.
Jim, if I could add to that, not as an expert at all, but our principals have been in the building since the day the kids went out. They've always maintained a presence in the building every day. This week, we started back with all administrators, so all 204 administrators returned to work. We did have some people that had some special exceptions, some health issues, and we're working with those individuals. Probably important to start looking at all those guidelines from the feds about 12 weeks of various types of leave and what happens if you have COVID-19 or a family member or have childcare issues and things. I don't know how it applies to small businesses and things like that, but there are a ton of rules and all that stuff. And as far as I know, they're at least in place until December this year. So we're trying to sort through some of that because we come back a little bit of another phase on June 1st, a larger phase on June 8th. And then we'll be back to just 12-month staff soon thereafter after June 22nd. So we went through a lot of signage and hand sanitizer. We probably put up 25 or 30 new hand sanitizer stations here just in our office building. But directional signage we put up everywhere in the building. You only go one direction. We put signs up on our elevators to occupants only. There's a whole bunch of things to think of, just even on a small scale. So to your point, Jim, thinking ahead's probably a good thing.
And there are posted again in the chat to everyone. The toolkit has some of this information in there, how to reopen. And Jill Thompson with the city has some things to address as far as possibility of gyms and then how the fire marshal might help you with capacity. Jill, good afternoon.
Good afternoon. Thanks, Paul. We did receive questions about operation of gyms, so I wanted to cover that any gyms or outdoor recreation or outfitter companies, they can operate outdoors as long as their classes or excursions are 10 participants or less. So we want to make sure people are aware of that. And then also a question that we don't yet have the answer for is, when gyms do reopen, will participants need to wear masks while they're exercising, or in the case of a dance studio during a dance class? So we're awaiting more of the governor's direction on that, and we do have that question from the business community to send feedback. But again, it's a balance between the health side of this as well as the inconvenience of wearing a mask. As Jim talked about, what restaurants could do to start to get ready, or any business, is know your occupancy number for your business. So the city fire marshal will take either a phone call or an email. He asks that you have the address of your business, the type of business you are, as well as a rough guess of the square footage of your customer area. And he will give you a occupancy number, as well as produce a sign that you can post at your business. If you're located outside of the city and in Washington County, we're working on resources for you there. But I think a general guideline is simply to make a best effort, a best guess at your occupancy, and then also make a best effort to be reducing that to the 50% guideline that we have in the first phase. So I think as long as you're making reasonable determinations, reasonable efforts, that is a good first step.
Thank you, Jill. And just again, to echo Jill and Jim and Dr. Michael, in your chat room, you'll see 10 things businesses can do to prepare now for reopening. It's a great checklist that you can work with. You can work with your professionals, whether they be your labor law attorneys, if it's related to labor questions. If it's cleaning, there are some local companies here that can help you assess your cleaning needs and sanitation needs to get you ready. And again, just look at the chat room. This is being recorded. I believe the chat comments are recorded too. But if you have any questions about any of these links, just let us know. We'll get them to you. Susan, that's all the questions I see at this point. So I'll turn it over back to you unless there's other folks who want to weigh in.
Paul, if I could just mention one thing while we're waiting for Susan. You know, another thing we want to encourage our business people out there is start thinking, you know, a little differently about what you may have to do to, you know, revive the revenue that you need to stay solvent. You know, as these other communities around the country are opening up, one thing we've noticed for many businesses is the customers don't return right away. It's not like you're going to go from, you know, no business to 80, 90, 100% of what you were before the pandemic started. It's taking time for the customers to have confidence coming out. You know, you need to be thinking about that. What's your business plan? I would sit and kind of rethink your business plan on what's the minimum you need, where you can kind of cut your costs, where you kind of generate new revenue by doing things a little differently. The businesses that are doing that are the ones that I think are doing the best under the challenges that we all face. So, you know, if you have, you know, talk to your consultants. SCORE is another organization. SCORE can provide some mentorship for you. They're located online. You could easily find them by Googling SCORE Western Maryland, I believe it's called, or Mid-Maryland, SCORE Mid-Maryland now. But you know, start thinking about that as well, because you're going to need to probably adapt to this environment as you prepare your business moving forward.
Thank you, Jim. And Susan, one public service announcement. I know a number of us on a call are working on the census. And just a reminder, we have all these things going on with COVID and getting businesses back open. And if you haven't filled out your census form, or if you have employees who need to, just a reminder that it's really important that we get a count that affects the funding we get from the federal government. And so that's my public service announcement, Susan. And with that, I'll turn it over to you.
All right, thanks. Thank you, everybody. Really just can't thank you enough for being on the call today. And I know that we have some elected officials on the call as well, and we encourage you to stay in touch with us, and we'll certainly direct any questions or concerns that we can to the right places. So you have our website available. Again, it's washcoroses.net. So please visit the resources there and let us know if there's anything else we can do for you. But thanks for signing up today and being here with us. And we're going to move forward with this and rise as we go. So thanks, everybody. Greatly appreciate it.